in shaping the world peace and sustainable development through interfaith harmony. Before we begin the session, as per our tradition, I now request all the dignitaries on the dais, all the eminent speakers of this session, to come forward to ringing the bell of democracy. Please, all of you, please join together and hold that rope, and all of you must stand in the line and ring the bell of democracy. So it's symbolizing together we can bring changes and we can kindle the flame of democracy to bring sustainability. I request all the dignitaries to stand in the line so that the photographers can see every one of them louder, and it's a ringing the bell to bring quality healthcare in India and around the globe. Thank you all. On behalf of the G20 Interfaith Summit 2023, I feel honored to extend a very warm welcome to all our panel members. And we are having Dr. Kezivino Aram from the Director of Shanti Ashram, Coimbatore, and she will be joining Mr. Yaqeen Sikandar from ACWAY UK, a common world among the youth, ACWAY. And Dr. Vijay Prabhakarji will be joining. He's the chairman of Global Strategic Alliance. Dr. Archana Patil, former director of Health Service, Government of Maharashtra, India. Dr. Subhash Salunge, sir, former assistant regional director of WHO, Southeast Asia, Mumbai. And we will be joined by Mr. Sachin Itkar, sir, Senior Program Advisor, Strategic Foresight Group, Pune. Dr. Baba Saheb Vishwanath Andale, sir. He's a senior scientist from National Institute of Virology, Pune. And Honorable Dr. Deepak Maisekar, sir, who is a former advisor to the Chief Minister of Maharashtra. And we welcome all these panelists to this session. I also feel honored to welcome our Honorable Colonel Harjit S. Bhagat, sir, who is the CEO of MediDect India, as a moderator of this panel discussion today to the G20 Summit 2023 and to this special sessions. We welcome each and every panelist and the moderator and all other delegates to this session on healthcare. We also appreciate the presence of Dr. Satish Pawar, former DHS Maharashtra, and also Professor Alex Husky from MIT WPU, and all other delegates and dignitaries to the sessions. Let me now request our technical team to play a very curtain raiser video which is depicting the theme of these sessions. IT team please, video.
This session is based on healthcare. The COVID pandemic highlighted the fragility of healthcare systems across the world. It also proved that the need to be prepared for future pandemics comes alongside the need to address inequities and inefficiency within healthcare systems. Healthcare has also been the leading edge of movements to build bridges between development and religion. It is the most traveled, but with a long way to go as well. We must recognize the vital role that religious leaders play in healthcare in order to build a more balanced and constructive appreciation of the religion-health nexus in the future. In this session, we will discuss about the balance between religion and healthcare.
Thank you for that amazing video encompassing our theme of today's session. Now, I would like our session coordinator to kindly come on stage and facilitate our esteemed dignitaries. First of all, I would like to call upon Colonel Harjit S. Bhagat, who is the CEO of MediDect India. Next, I would like to call upon Mr. Yaqeen Sikandar. Next, I would like to call upon Vijay Prabhakarji. He is the chairman and Global Strategic Alliance Inc., editor-in-chief of the Global Eye Digital News Monthly, Greater Chicago, USA. Next, I'd like to call upon Dr. Archana Patil, former Director, Health Services, Government of Maharashtra, Mumbai. Next, I would like to call upon Dr. Subhash Shalunke, who is the former Assistant and Regional Director, WHO Southeast Asia, Mumbai. Next, I would like to call upon Mr. Sachin Itkar, who is the Senior Program Advisor and Strategic Foresight Group, Pune. Next, I would like to call upon Dr. Babasaheb Vishwanath Tandale, who is the Senior Scientist at the National Institute of Virology, Pune.
I would like to call upon Professor Satish Pawar, sir.
Yes, sir. Next, I would like to call upon Dr. Deepak Maiskar, who is the Designation Advisor to CM and ex-Divisional Commissioner, Pune. Next, I would like to call upon Dr. Satish Pawar, who is the former Director of Health Services, Government of Maharashtra, Mumbai.
Thank you, Professor Pandey, sir, for joining us and felicitating our guest. Now I request our moderator, Honorable Colonel Harjit S. Bhagatji, to address to this august gathering and by giving his introductory remarks and set the tone for the panel discussion. Over to you, sir.
Thank you very much. Can I be heard at the back? I think. Can I be heard now? Yeah, okay. So very warm welcome to the young students who I see in front of me, who waited very patiently for this session to start. And a very warm welcome to the dignitaries who are with me on this breakout session as panelists. We will be looking to draw from their vast experience on certain points around which this discussion on healthcare has been based. As was given in the short film that you saw, when COVID hit, and COVID is one of the themes for the discussions today, healthcare came to the forefront. Never had the world seen a pandemic of such magnitude, at least in our times. And obviously, things seemed to go out of hand. It seemed as if the healthcare system around the world was inadequate. I use the word seemed because to us, that is what we thought. We thought there were not enough doctors, there were not enough paramedics, there were not enough nurses, the facilities were not adequate. So this is a question that will be answered by the panelists. Other than this, we saw people crossing community boundaries and helping one another. Humanity came to the forefront. A very big positive from the pandemic. It also raised the question of, should this happen again, will we be prepared? We have to be prepared, but how is the question? And we will get answers to this question from the panelists. Health, when you talk about health, it's not just physical health. It encompasses much more. Emotional health, psychological health. And so the role of faith-based organizations, the role of religious leaders, the roles of religion is something that the panelists will discuss today. A brief introduction to myself. I was in the army for 30 years. I retired as a colonel. From Ladakh to Andaman Nicobar Islands, from the east of Silchar to the deserts of the western borders. I've been there, seen it all, and I pretty much know what India is all about. After leaving the army, I joined the healthcare system. I've been in healthcare for 12 years. I was in Fortis hospitals. I was the director of 5 hospitals, including a 1-year stint in Uganda. So when I speak about healthcare or when I listen about healthcare, I know what's going on because during the pandemic, I was with Fortis. So with this background, I just want to lay down certain timelines. I would request all the panelists to, now that some panelists haven't come, so we have more time, I would request the panelists to speak for about 7 minutes. 3, 4, 5, 6, 7, 6 are 42, so I had given 40 minutes, so 7 minutes, give or take a little. I see a lot of pens with students, with paper. Now, I hope these are going to be used to ask questions because every one of us was affected in the pandemic. And so a lot of us would have a lot of questions. And I hope that some questions that remain unanswered come from the students. And so I'm giving 20 minutes to a question-answer session. Then we have a short presentation by Mr. Alex Henkley. He's got another beautiful, talk to give on integrating modern medicine with Ayush. Now, how many of you know what Ayush is? Hands up. I want to see hands, raise of hands. So Dr. Alex, you have a very educated audience. So with that, may I request, we start the session and we'll start with Dr. Vijay Prabhakar.
Thank you, Colonel Harjit Bhagt, for those introductory remarks. Good morning to all of you all, and so happy to see that we have some interested public health students and the young generation, today's present generation here today. Healthcare in a G20 Interfaith Summit. Now, that itself is a trend. First time. No one would like to put, I'm sure our moderator has already alluded to the different types of health, very articulately said, which includes spiritual health also. So that was the most intriguing when we heard about what will healthcare be in an interfaith summit. Having said that, the theme of this G20 Interfaith Summit is shaping world peace and sustainable development through interfaith harmony. You know, the Bible said, the faith of a mustard seed can move mountains. And I truly believe that faith is a very intrinsic instrument, the greatest weapon any one of us can possess, a faith in the Almighty God. Having said that, Napoleon, who you all are sure familiar with, said, the world suffers a lot, not because of the violence of bad people, but because of the silence of good people. Now, that's so important. We are talking about peace. We assembled earlier today and yesterday in Professor Vishwanath Karad's World Peace Dome, where the global visionary founder, your founder, Professor Vishwanath Karad, has demonstrated that social reformers never stop working for mankind, humanity, and for a better future and world. So why we should stop learning? Professor Karad has proved to the world that hope and peace does not happen by itself. It has to be triggered. To be triggered, you have to believe in yourself. Today, we are all here in this room gathering with the learned minds. And I strongly believe, like an American philosopher, Margaret Mead, said, that it doesn't take a whole lot of people. It just takes 2 or 3 like-minded people to make change. I'm based in Chicago, USA now. I've been there for 40 years. I'm a graduate from Madras Medical College in Chennai. And I had the experience of seeing some of the 2 major public health. One was the AIDS epidemic. If all of you recall, I don't know how many of you all were born in 1985-86, when AIDS rattled the world. And that was the first public health epidemic which was really engrossing. It started in the United States. At that time, I was the first Asian American health commissioner for a tribe. You all know of Red Indians in India, as we call it, the American Indian tribe, an indigenous tribe. And I was the health commissioner there in Wisconsin for a tribe which spread out, which had, if you think that America, you all see the good stuff of America, but when you visit the Native American tribes, the original inhabitants of the land, their poverty index, their health index, education index, all far below India. And it was for me, I was a public health student right through my MBBS. And in 1980, I was selected by World Health Organization during my final year to visit Managua and be part of a World University Service task force to rebuild the healthcare system. Managua is in Nicaragua. If you all look up history, they had a big revolution in 1980 where the whole South American country was destroyed. And there, we were there camping and we reconstructed their medical education system. Having said that, what is so important is interfaith harmony. The greatest challenge we faced in AIDS epidemic in educating the Native American community, they thought they are taboo to it. HIV and AIDS can't reach them because their religious belief. They had their own Native American church, they worshipped the fire, they had their own beliefs, and they're very strong. But it took a lot of education, a lot of working with them, and using all my expertise from India to reach out and break through to them. Having done that, the government of the United States made me an ambassador for AIDS to visit all the 500 other tribes to educate them. So public health is a very important branch of medicine, but often mostly neglected and treated as a stepmotherly branch of medicine today in India. But after COVID pandemic, from an epidemic we go to a pandemic. After COVID pandemic, as our moderator had referred to, public health took center stage. Public health regained its whole importance. World stood still. It was only the public health practitioners who had to meet the challenges of the COVID pandemic. And that was so many challenges, and we were there. And one of the greatest challenges, if you recall, in the second phase of COVID pandemic in India in 2021, in the end of April and May, we were reading in papers 4,000 people were dying daily. We had to rally to do something. Our Congressman Danny K. Davis called me and said immediately, Dr. Prabhakar, do a press conference. I said, why, Congressman Davis, do a press conference? He said, don't worry, you do a press conference. I said, though India, thousands are dying. What are we going to tell the media? He said, no, call for a conference. So all Indian leaders I gathered together and we did a conference in Chicago on May 2nd of 2021. And that brought India's COVID pandemic on center stage in the United States. And after that press conference, you know, communication is so important in any time. And having the proper communications, mass communication in any field is so vital. We were ignorant of the fact what a press media could do. And that changed the whole, that's how India was able to manufacture vaccines. I'll shortly tell you. Soon after the press conference, I received a call from Reverend Jesse Jackson. He is the national civil rights leader who walked with Martin Luther King. And he said, I want to help India. What can I do? I'm going to call out to all President Biden and Kamala Harris and Pfizer and all the vaccine manufacturers to do something and to ship vaccine doses to India. And that started for us the 30-day team. We went to city with Reverend Jesse Jackson Sr., who rallied President Biden and Kamala Harris. And then that was when President Biden decided to donate millions of vaccines, not only to India, to 150 countries. But that time, our India's ambassador told me, you know, what is important is we need the ingredients to produce vaccine in India. You all know India had this Pune factory, serum, and also the Bharat Biotech in Hyderabad. But 80% of the ingredients had to come from America, and the quantities that were needed were not able to be passed till President of the United States invokes the Defense Production Act. So then we had to campaign. The people movement involving religious leaders, involving the community activists. That's what public health is all about. We treat the community while physicians treat individuals and have. But this was a very big movement which we did, and we succeeded on May 19th when President Biden had acceded to our request. And then we also invoked the Defense Production Act, which was allowed not only India, Brazil, and South Africa import the ingredients they needed for manufacturing vaccines. Having said that, I would just like to say that the importance of faith leaders, Reverend Jesse Jackson is an important civil rights leader based on faith. He's a Christian hero for the black Americans in America. He took a major role. And he didn't bother that India were Hindus and Muslims or Pakistan, but he was also wanting to make sure all the developed countries and third world countries receive vaccines. So the importance of interfaith harmony with healthcare was a classic example of how we were able to help not only India, but 150 countries. Having said that, you all must be knowing diversity, equity, and inclusivity today are the buzzwords, whether you go to the corporate world or to the education world. But let me tell you, young minds, the present minds, that the invasion of artificial intelligence and digitalization is rapidly changing our landscape in every sphere of life. You know, and interestingly enough, I feel I would like the other panelists to address, but faith, I feel, cannot be touched by man-made or artificial intelligence, because faith belongs to the supreme. And I would like to hear the other panelists and even your young minds to tell us whether artificial intelligence today has gone into every sphere of the field. I was there in Chennai, visited the first Center for Excellence by Siemens, the leading software company, where even food is manufactured and printed, meat and fish in research. The manufacturing industry, the robotic surgeries, healthcare is revolutionizing such a rapid form. And we were part of recently in June when Prime Minister Modi came, there was a group of people trying to lobby United States Congress to regulate artificial intelligence, because unregulated artificial intelligence will cause more harm than enlighten the people. So with these thoughts, I would like to tell you that I hope that faith, which is what we all believe is a cornerstone, cannot be or will not be. We'd like to hear a discussion from you guys. You know, we are all ancient and we are on our way out. But I think interfaith harmony is of paramount importance in meeting the challenges of public health and healthcare today. And closing, I would like to say, problems never stay long. They just put their signature in the book of experience of our life and move away. Rivers don't drink water, they carry. Trees don't eat fruits, they bear. Clouds don't bathe, they shower. So let's perform our karma knowing nothing is ours. Yes, believe in yourself, victory is yours. God bless each of you. Thank you.
Thank you, Dr. Prabhakar. Thought-provoking. We'll come to the students and ask them what they think about that. I now call upon Dr. Vishwanath Tandlej. He's a senior scientist at National Institute of Virology in Pune, and he will have something very interesting to tell us since he was absolutely in the middle of the virus doing things that the entire nation and the world needed. So over to you, sir.
Thank you, sir. Thank you for this opportunity to interact with the young generation here, predominantly seen in the audience, and interacting with all the experts in healthcare and faith and its interface. I have been working in National Institute of Virology under ICMR as a medical scientist. I am MD in preventive social medicine. Great. I've done diploma in bioethics and also health communication. So I am learning still, and I have been part of NIV's response to the COVID and earlier outbreak response activities, including H1N1 pandemic earlier and different outbreaks, because my part of activities in NIV is outbreak investigation and response primarily. And I undertake the public health research that is needed to be applied directly in health emergencies. So I come from that background. And what I feel with almost 20 plus years experience now in epidemiology, that we have a role to play, that epidemiology as a science has not been considered as an important science that can help health emergency response very quickly and maybe rationalize the approaches that we take in response activities. So I have a write-up, I will be going through that. I felt this is really important to highlight some issues. So as we all are aware that COVID-19 pandemic has impacted human lives and livelihoods adversely, and we know that there are other epidemics that we are needed to respond. The long-term impacts are still not known, because we know that post-COVID and long COVID and all that issues, health ailments, heart ailments, all that are yet to be seen and associated with infection and vaccination also. What we need to do is understand why the health systems disrupted. The issues of healthcare provision was an issue that there were, on some of the times in epidemic, we had to stop immunization activities that are essential activities, including some maternal health, child health care aspects. And these are learning lessons that how can we keep continuing the healthcare services even during the health emergencies. Coming forth is the interest that epidemiology has got in pandemic. Everyone is knowing now that what epidemiology and what epidemiology does. So let me tell you that epidemiology has a great role to play in terms of surveillance, in terms of response, in terms of community education, all that. And that is why we need to have a strong EP workforce, epidemiology workforce on the grounds at various levels, including block levels now we should consider. And there are taluka health officers being put in Maharashtra government now. Earlier it was just the district health system. Now this is really going to help in future. That is what I understand, that this will be a very important aspect. In addition, epidemiologists are known as disease detectives, and you may be aware that there are epidemic intelligence service officers in India. There are FETP programs being run by ICMR in field epidemiology, where they are training the workforce required for these epidemic response activities. I come from a laboratory. I am at National Institute of Virology, but as I told you that I am required to respond in field. And there are a lot of teams of scientists working on COVID and other infectious diseases, virus diseases in institute. We have been successful in coming up with the requirements of quick diagnosis, vaccine development, pharmaceutical development, all that has been contributed by NIV significantly in the past 3 years. And we are continuing our efforts in all spheres of health research and medical research activities. What we need is a multi-sectoral response, and that is every discipline that interacts with other health, and it brings value and addition to what we can do better. In terms of risk and communication of risk to the populations, it is very important that we understand risk, that communities' beliefs and perceptions, and we need to educate community better so that they are ready to respond to such kind of emergencies, and community readiness programs as are part of US. There are many activities that US does about community readiness. We lack there somewhere, and we should actually consider that as a priority. Health literacy can be given a importance because, again, there are many programs, health programs, where community education activities are not taken that seriously, and maybe that is the way we need to engage with community and understand their requirements. I'm bringing up citizen science concept here and coming up with the idea that community epidemiology as a concept. We know that community epidemiology is a discipline. We need to take epidemiology as a science and teaching science to communities to be ready. I think that is one of the aspects that I will bring to this forum for discussions. Participation has also been considered a very important activity, that community is involved in surveillance of their health problems, and they are actually the partners of healthcare provision and also health maintenance and promotion activities. We, as a research institute, are required also to undertake research, and we need community on board for research agenda, and we are working with communities as cohort studies for understanding disease burden in communities. I feel that this is another aspect where research institutes need to consider, and this is being taken care by ICMR in some of the research studies. What we need is a citizen engagement, and it is citizens, if you see the Constitution of India, there is a mention that a scientific temperament needs to be built in each and every citizen, that we have a responsibility here to deliver, that we need to know what we need to know for ourselves, for our communities, and for our nation. And that is why I come up with the last thing, that on this special day, and this is a World Field Epidemiology Day on 7th September 2023, the third one, first one started after pandemic in 2021, that, and this is the theme that this day has, we have to increase the diversity, equity, and inclusion to make epidemiology science popular, understandable, and applied by citizen scientists, citizen epidemiologists themselves for achieving Vasudhaiva Kutumbakam, one health, one family, one future. Thank you.
Thank you, sir, to the insight of your work. I now call upon Dr. Archana, who is the former Director of Health Services with the Government of Maharashtra. And I think the country knows that Maharashtra did an amazing job during the second wave of the pandemic, and I'm sure she had something to do with that. So let's hear from her.
So good afternoon, everybody. All the experts, panelists on the dais, all the MIT faculty members, and the students from those who are very interestingly studying in the public health. So basically, as sir told, being in charge of the War Room of State of Maharashtra for COVID and in charge of COVID immunization program, just I would like to give a brief about some of the important aspects. Will not go in much detail, but basically what was the situation in Maharashtra, how the COVID was different than other diseases, what challenges we faced, how we try to strengthen that, and then the important part, how the religious and faith-based organizations can help in the not only COVID, but for the other public health emergencies or maybe regular health activities. So, as all of you know, that we have experienced 3 waves of COVID pandemic, right? And the second wave was the worstly affected, not only in Maharashtra, but all over the nation and all over the world. So basically, if we try to, some figures, why I want to give you, because you will get an idea how much was the problem for that. So basically, how many cases we handled? More than 81 lakh cases we handled, and more than 1.48,000 deaths occurred in the state of Maharashtra. And when we compared it with the national level figures, about 20% cases from the India were from the Maharashtra, and about 25% deaths were from the Maharashtra. Just two figures I would like to give you. On single day, the maximum cases that were diagnosed were how much? 69,000. You can take it as a 70,000 also. So just imagine that in a single day, in state of Maharashtra, newly cases diagnosed were about 70,000. And only last another figure, that is when we see the active cases, we are knowing the term active cases which was used in the COVID. So 6.99 lakhs means about 7 lakh active cases were in Maharashtra on the highest day of the pandemic, that is in the second wave. And out of that, we have to give treatment because about 9% cases were critically ill, requiring oxygen or ICU facilities. So that was the major problem, and that was the magnitude of the problem for COVID. Some of the facts you also know, how the COVID is different from other diseases, right? So it is basically, medically it is different, and there's so many facets. The medical facets, social, psychological, spiritual, financial. So all these facets for the COVID-19 really had given problems for each and everybody, not only in the state of Maharashtra, but at world level. Medically, yes, you know that it was a new disease, diagnostic facilities, treatment protocol were all new for all of us. So it was learning from everybody, from state level to those who are actually treating. It was really new for everybody, right? Another important thing was that the mode of transmission, if you see, it was both. It was direct contact and also it was airborne. And so the fastly rapid number of cases increasing in the slum areas of Maharashtra. Mumbai, Pune, Nagpur faced maximum problems. You have heard about the Dharavi. In single room of 10 by 10, more than 15 persons are living, 15-20 persons are living. So because of these mode of transmissions, the disease spread very fast. That was major problem. When we see these social problems, you know, the families were affected in a disease. And not only families affected, but the number of deaths occurring in that family were much more. Can you imagine that in one single family, 1, 2, 3 deaths are occurring? And the important thing was, it was not possible for family members to attend their last rituals. That was really major problem. Isolation, that was also really issue for that. The migration of the laborers that you have also heard, we cannot forget that subject, how they were migrating, how they were going. So many social problems, they created a major challenge for all the health system, not only health system, but for the government. So when you come to the financial, yes, loss of wages were there. Then also the economical system was almost standstill at that time. And the huge medical expenses led to out-of-pocket expenses. You cannot imagine how much the patient had to pay the bills of for the medical treatment. And therefore, financially, it was really a major issue. Then the psychological, yes, the patients admitted in ICU. Can you imagine that in front of them, 1, 2, 3 deaths are occurring? So how they must be feeling about that? And therefore, that psychological trauma was really a major issue to be tackled in our ICUs. Another problem was the isolation that faced the families. Nobody was able to go outside, and therefore they had really an issue. The interstate travel of the laborers, that was also an issue. Then if you come to spirituality, I'm not an expert in the spiritual things, but please, you are also aware. During the COVID pandemic, the way instability about life, every one of us experienced, that was never there in any of the pandemic or in any case of the disease. And therefore, the instability about the disease. And another thing was that if you have sufficient money, what we feel that if you have sufficient money, we have no problems, we can do anything. But that it was not at all truth. And many of them have faced that in spite of everything, the patient cannot be survived, right? So these were the issues, challenges about how it was different from the other diseases. Basically, the major problems and the health system faced, it was definitely related to diagnostic, treatment, availability of medicine, because medicine had to be manufactured, and therefore there were a lot of time spent, required, not spent, it was required to make available diagnostic tests, to make available medicine. That was really an issue. HR issues were really a problem. Basically, the number of patients coming and the HR, they were really inversely proportional. And the staff working in that under tremendous pressure, not very well aware about the technical aspects, and they were worried about their own health and their relatives. When I am working in the hospital and when I go home, if I transmit my disease to my family members, that was the biggest worry for them. So the HR aspects were also in addition to insufficiency. These were other lot of aspects for that. The private sector in first phase, it was non-functional. And in its second phase, it was functional in such a way that, yes, it helped also. But then the over-diagnosis, over-treatment, treatment protocol were totally different from the WHO and Government of India, and the bills that were required to be paid to them. Last important point about not only medicine, but other part like oxygen availability, ICU, ventilators. So these things were required, and it was not possible to make them available in a shorter span of time, because the pandemic spread like anything, and it was not possible to cope up with all those things. But then we had some very good practices also, and we really learned from that. And I think we should be grateful to the system also, because we had a hands-on experience. You know, the oxygen was the mainstay of the treatment, and the important thing that we introduced in the health system was oxygen sister. So she was supposed to monitor only oxygen of that patient which was critically required. Second important, can you imagine that every day all the health functionaries from government and private were regularly reporting to the online system. A very good portal developed by Government of India, and we were getting on every day how many newly cases diagnosed, how many admitted, and everything was clear. So it was true for both, for vaccination also and for the cases also. So that was good for the respiratory etiquettes. That word we used during the pandemic. We were not really very good that we should keep distance, we should use handkerchief and repeated hand washing. So these things, they help not only reduce the transmission of COVID, but also for other diseases transmission. So that was really very good achievement, and what we have learned from that. We should have a preparedness, that I will talk about that. Then another thing was that the infrastructure should be made functional in very shorter time. That was a really thing that we learned from that, and for which also we worked a lot. Then another point was when there is a pandemic or any disease, what we think, it is the responsibility of the health department. But for the first time, we could get the importance of other departments, other stakeholders, NGOs, and religious and FBOs also in that case. So these were the important learning for us. The preparedness for the long-term complications and sequelae was also there, and the private sector, coordination with the private sector, we learned from that pandemic very well. Now, how the existing system was strengthened, or it is yet being strengthened also. We had an emergency COVID response plan, and in that, the strengthening of the health system, not from the state level, but up to the block level, the various interventions are being tried and are planned, and they are being implemented. And basically, they are related to ICU management. So the ICU facilities in all district hospitals, and not only district hospitals, but below that. They were available previously, but do you know, we had only 6 beds in ICU of district hospital. What those 6 beds will do when there is a pandemic? And therefore, that was there. The pediatric cases were much more, and in the second wave especially, and whatever beds we are having, so we improved the bed capacity also. The laboratory capacity, in that the decentralized laboratory, so not only at the national level, but also national level, state level, but also at the below block level, the laboratory system is also being strengthened. So that step was taken in that. The important, yeah. Oxygen capacity also we tried to improve in that case. And the other aspects of the whatever is required for treating a patient, all those things are being strengthened from at various level, so that if any pandemic comes, we try to develop field hospitals. So these hospitals, we can make them functional immediately in case of our emergency. So now we'll come to last point about the religious leader and faith-based organization. Yes, it is known from ancient period that the FBOs plays a vital role, especially providing the care to the marginalized people and those who are in the difficult areas. And the various studies have also proved that the religious practices, they lessen the severity of the disease, they reduce the chance of getting the infection, new disease, and also recovery becomes faster. In case of COVID, the FBOs helped us a lot in management, in the diagnosis, in the support, and very important, the dignified disposal of dead bodies. And therefore, all these religious bodies helped us in that case. The last point I would like to stress is that yes, religious leader, FBOs, they help us. But what I feel that we should have a systematic approach that identify the problems, identify FBO, their capacity building, implementation, and then try to review how they work so that there can be a systematic approach for the involvement of FBOs. So I'm sorry, I have taken some 5 minutes more, but then it was really a good learning for all of us, and we tried to give the best possible, as said, the Maharashtra was doing this. So thank you very much.
So before continuing, sorry to interrupt in the middle, we have one of our guest speaker here, eminent speaker here, Mr. Yaqeen Sikandar, ACWA UK, and it is a common world among the youth, and he is an eminent speaker for today, so I request our moderator and Professor Neeraj Mahindru sir to felicitate him. Please, please. So big round of applause for our guest. Dean, School of Health Science and Technology, Professor Neeraj Mahindru sir here. Thank you, moderator. Sorry to interrupt, and continue with your session. Thank you.
I know that Dr. Archana still had a lot to say because she was so, personally involved with the COVID pandemic, but I have to be the bad guy. We have time restrictions. So I'm sure, she will come back to the university over here maybe later to give an in-detailed analysis and her thoughts on what really happened in COVID and how we dealt with it. The next speaker, may I request Dr. Subhash Solanke, the former Assistant Regional Director of the World Health Organization, Southeast Asia, Mumbai, to give his thoughts.
Good afternoon, friends. At the outset, I wish to really thank organizers for giving me an opportunity to visit this institution first time. Even though Vishwanathji, I know Vishwanathji Karat 30, 40 years back, when I was Director Health Services Maharashtra, we had close interaction for the medical colleges which were initiated by this institution. So, first opportunity I got to visit this great kind of an infrastructure that has come out of his ideas. And two, also an opportunity to meet old colleagues like Dr. Mesekar, and I feel as if I'm sitting in the divisional commissioner's office, the auditorium or the office meeting room, wherein he used to be there and I used to sit next to him, and we used to review the COVID performance and also weekly review by the Deputy Chief Minister. And with all the MLAs, I can tell you one thing, my dear friends, the way we responded as a country, the way we responded as a state, the way we responded as a division, the way we responded as a district, as a taluka, as a PHC, as a village, and individual Indians, absolutely no comparison, no comparison. I had been to UK, I had been to UP, Uttar Pradesh, been to Bihar. I have traveled this entire country. Even now, I am part of the various evaluation teams of WHO and also Gates Foundation. But before going into that area, I'm pretty certain you have seen Hindi movies sometimes at least. Dekhte hai na kabhi kabhi. In good old days, there used to be movies in which the doctor used to come. That fellow never looks like a doctor, but he uses a stethoscope, looks at the patient, and then say, "Ab kuch nahi ho sakta. Ab bas upar wala hi isko kuch kar sakta hai. Ab dawa ki nahi, dua ki zarurat hai." Absolutely, my dear friends, ये दवा की नहीं दुआ की जरूरत है. ये इतना सही है. It's so true that when doctors themselves get desperate that we are doing our best, but now this is the end of the so-called science, so-called technology, so-called the best possible hospitals, 5-star hospitals in these countries have made blunders, not only in this country, outside also. From that perspective, coronavirus is a great example for this world to learn that you need not boast that we are the great country, we have billions of dollars as a GDP, we have sent up human beings on the moon, and we are the superpower. That corona tiny virus has given a solid kick on the whatever organ that you want to say to these so-called boastful countries, clearly indicating that there is an opportunity for human beings to improve upon, to have faith, to consider that there are limitations. And I think earlier somebody said about the artificial intelligence, which is going to be, it will be fully exploited. Let me assure you, irrespective. No government will be able to check it in totality, but there is real need to ensure that this is not used for against the human beings. So that is going to be a great challenge. But from our perspective, from Corona's perspective or from COVID's perspective, let me assure you one thing, COVID or Corona is not going to be the last pandemic. The mutation is already taking place. It's not that you will see it after 100 years. Even though we saw it after 1918, this pandemic came on full throttle and impacted and affected the globe, the entire world, and created absolute mess. However, the impact of that and what Dr. Archana Patil has described, what happened in Maharashtra. I was clearly one of those persons who were impacted. I got infected in Amravati. Mesekar sir told me that, there are a lot of cases coming up. The Deputy CM said that, go and see what is happening. So I went to Amravati. And in Amravati, I found that all the Amravati town, tribal villages, everywhere cases after cases. So I called up from the field to both Dr. Mesekar and to Deputy Chief Minister, who is also Deputy Chief Minister now. I said, sir, we are heading for serious trouble. Unfortunately, that time, the higher-ups were saying, no, it is not something new mutation or nothing like that. But it happened. And there, it impacted in such an adverse fashion that not only it affected Vidarbha and then eventually Maharashtra and then eventually country, and we had lots and lots of cases and deaths. My dear friends, my dear friends, the COVID and Corona has given us a clear indication that medical science, irrespective of the progress that we are making, and which we should continue to do that, there is one element which is superpower, That we have to keep in mind and respect it. Without that respect, if you are going to be arrogant because you have science at your command, no. The nature is going to be definitely more superpower than what you call yourself as a superpower. This is for you, a younger generation. Thank you very much.
Thank you, sir. Thank you for your thoughts. We are running a little short of time. May I now request the Honorable Mr. Dilip Maisekar ji, who was the former advisor to the Chief Minister of Maharashtra, to give his thoughts.
Good afternoon, Colonel Bhagat ji. Good afternoon, dear friends and my colleagues. Basically, I am probably the only non-medico here on this platform. I was into Indian Administrative Services, and when COVID struck, I was Divisional Commissioner Pune. Probably for the first time in Maharashtra, we had found that case, and rest we know is history. At that time, my routine used to be morning 5 o'clock till 12 midnight. Was looking for what is happening in Italy, because that was the worst affected country at that time, having one of the best world health infrastructure. And then how are we to cope with it? As Archana Patil madam just said, there were a lot of other issues: labor migration, lockdown enforcement, students' movement, and above all, the health management. And after, when I superannuated in 2020, the then Chief Minister wanted me to be his advisor on COVID. And I did serve for 2 years with him. The day he resigned, I resigned as his advisor to the Chief Minister. See, just now a lot has been spoken about why did COVID come, what are likely to be the future challenges. Right now, I'm not working in health. I'm working on environmental change. The carbon footprint that we are creating, the carbon credit system that is likely to come in India soon, because in my opinion, it is my firm conviction that as a species, we forgot that we are one of the species on Earth and to what extent we should exploit environment. We are going beyond the limit, and therefore the problems are arising. Doctor just said about AI, you already have a test of it with ChatGPT. ChatGPT is one of the instrument of AI, and it could go further. But my concern is more than AI, it is the gene manipulation that we are doing. I'm basically a student of genetics. The recombinant DNA technique that we are using, the clone technology that we are using. I had been in USA last fortnight. My son is there. He has a very good pup. And I said, he's so adorable to you. Something happens to him, what happens to you? He said, don't bother, Papa, I already arranged for a clone for him. So the clone will come. And I don't have to worry. And the same pup would be with me, that particular. But we are playing with genes. And that is, I think, one of the most risky situation that we are handling. What I did in COVID, I already have written a book on it and writing another one on it. So I would not be spending my time on it. But what are going to be our future challenges? Will it be only because of gene manipulation? The kind of war we are seeing, biological war, is likely to come soon. We are seeing the war between Russia and Ukraine. And we don't know when it would, not that particular war, but any biological war or nuclear war which will come in future. And are we prepared for that kind of an eventuality? Is our health system prepared for that kind of eventuality when not only the disease that strikes, but the man-made disasters strike? We talked about interfaith. The basic theme of this conference is faith. In COVID, we saw there were initial some hiccups, there were some problems with religious congregation, which led to spread of COVID, but soon people realized how are we to, she just gave an example of dead body to be disposed. Without any conflicts in faith, everybody cooperated in disposal of deads. Because probably this was the only disease. Generally when you are ill, people will come, meet you, give you fruits, give you something, they will support you. But the moment people knew you have COVID, they will run away from you. So it was totally a different situation in COVID. So when we are talking, and then these interfaith persons came to our help, to the administration help, in disposing the dead bodies, in ensuring that they are properly cremated. And there, the faith did not have any impact. As I said, the health, when we are talking of interfaith, there are only two truths in human beings' life. One is birth and second is death. There is nothing, anything in between is just a transitory phase. So your religion is decided by your birth. And COVID was a time where everybody was fearing his death. Nobody, including me, though I was working, though I was around 60, I was told that I could go on leave, but I continued to be there, visiting the various affected areas. I had COVID twice. I came out of it. That's a different story. But everybody was knowing that the death is about to come and death could come any time. And that increased the faith of human being in the religion, in that Almighty. And I think what is to be, as I said in the beginning itself, the climate change, where will it lead, we don't know. The genetic manipulation, where will it lead, we don't know. We should never forget that we are only one of the species on the earth and not the sole species. And whenever we are exploiting nature or the natural resources, there has to be a limit to it, and that we will have to follow. At the end, I will say, trust in God and do the right, what is right for the humankind, for the mankind. Thank you.
Thank you, sir, for those very thought-provoking comments and your thoughts. I now come to the last speaker on the panel, Mr. Yakin Sikandar, who's working with the youth, and he's come from UK. So over to you.
Thank you so much, everybody. It was beautiful listening to all your thoughts. I'm from India, even though my looks might say otherwise. So I have actually just come from my hometown, which is Kashmir, right? So I work with this organization called ACWE, which is a common word among the youth. And our emphasis is on interfaith dialogue and promotion of peace through delivering grassroots activities, which includes mental health. By profession, I am a psychotherapist, and I'm a research scholar in clinical psychology. I'm based in Istanbul, Turkey. Now, talking about, a lot was talking about, we talked about COVID, or when we talk about healthcare. I think it's really essential when we talk about health to also address mental health and mental health challenges. India, how people perceive this country from the outside is that you watch Bollywood movies and you are like, Indian people are really happy. But if you see evidence-based journals and we talk about happiness indexes, India is actually one of the saddest countries. And that is because we suffer in silence. We don't talk about mental health challenges. Everybody might look like, when we are physically sick, everybody can see that. But when you're mentally suffering, nobody sees that challenge. And that is a big challenge that we are facing, especially after the COVID-19. Because COVID-19 pandemic, as everybody has discussed on the panel, it really exposed a lot of the healthcare systems. And the countries we thought are really very highly developed, they actually fought over toilet paper, right? And in terms of mortality, for example, India has actually in COVID-19, India's mortality rates were very less, but I do believe somewhere how it was handled through the media, through the agencies, it felt like doom and disaster that even scared the people further, right? And with COVID-19, people were scared, like it was said. And what is the natural response of human beings to unknown? It's fear. Whatever we don't know, we fear that. And that's why intercultural or interfaith dialogue and peace promotion is essential, because we don't know the other. So whatever religion, whatever person, whatever other color is unknown to us, our primal response is we show fear. And in fear, we cannot think clearly. So we take steps which we could have improved or things that could have been prevented. I remember when I was doing my bachelor's in Malaysia in psychology, we did one of the experiments in experimental psychology, which is one of the subjects. So we told the students, you have to come to us, it was a part of the assignment, and we're gonna give you pills, and those pills really improve your memory. So we had like 20 or 30 students, and we gave them some pills, let's say 3 weeks before the exams. They take the pills, they're happy about it, and guess what? Their GPA actually increased that semester. So after the exam, they're like, can we have some more of those pills? It might help us. And guess what the pills were? They were sugar pills. You just compress sugar and give it to people. It's called placebo effect. My point here is the autonomy of mind over the body is really huge. And why do I want to emphasize it? Talking about United Kingdom, for example, population of 60 million. They have 750,000 people working in the mental health care sector, social workers, clinical psychologists, etc., right? We are 1.5 billion in this country. And according to the survey of July 2023, the RCI, which is the Rehabilitation Council of India that licenses clinical psychologists, we have 3,372 clinical psychologists, most of them in New Delhi, which means this, in other words, if I had to break it down. For 500,000 people, we have one clinical psychologist or therapist. 500,000. If you're a full-time practitioner of clinical psychology, you would actually mostly be able to see 30 people, 35 people. But imagine per head, we have 500,000 people. So this gap, this deficit needs to be fulfilled. And people were really inside their homes. They were frustrated during the pandemic. And I used to do Instagram live sessions every single day. People even started asking, in a lighter sense, is that okay if I start talking to the plants at my home? Is that okay? I said, it's okay so far as they don't reply back. If they do, then it's a problem. Why? Because people are just crammed up and people were scared. So the point that I want to make after all this is we really need, at a policy level, because I do a couple of things, mental health advocacy as well as humanitarian aid. So what I would love to be the way forward, especially for young people as well, is investing in our mental health is really essential. Really essential. At a policy level, government should have much more funding when it comes to mental health, because we have a dearth of people who practice mental health, as well as we have to be prepared and ready for the disasters. I was recently, a few months back, in Adıyaman, which is the southeast city in Turkey where the earthquake happened. It was one of the 10 cities. We were there for a couple of weeks on the ground. But the disaster response, it was good, right? So one pandemic has happened. We have no proof the other one would not happen. So apart from investing in mental health, we also need to invest in disaster preparedness and readiness. And I think that is the way to go forward. And that's all I would have to say for now. Thank you so much.
Thank you. Interesting point about mental health, which I'll touch upon a little later. During the pandemic, we found that infrastructure, medical infrastructure, fell short. It was inadequate. And that was the hospitals, the hospital systems, the healthcare systems. And one started thinking that there was a need to integrate alternate medicine with the existing healthcare system to widen the outreach to people in the country. You have areas where you don't have hospitals, but you will have a Ayush doctor, you will have a BMS doctor, right? So, in keeping with that, we have Mr. Alex, who is going to speak for 5 minutes, sir? Five. 5 is good. On integrating Ayush with modern medicine. This is something that's been on for the last 2-3 years. And so it would be interesting because Alex has been involved with the Niti Aayog, and coming from there, it would be interesting to know what the thought process is in the government and how is Ayush being integrated with modern science medicines. So over to you, Alex.
Thank you so very much. I think the last speaker would like to know, sir, that the use of transcendental meditation has been definitively shown to reduce mental illness by 80% nationwide. There have been several studies on these complementary systems of medicine. These on what is commonly known as TM, which is practiced and taught at Dr. Vishwanath Karad's insistence, is extremely effective in improving not just mental health. Cardiovascular diseases are reduced also by 85%, and if you add Ayurveda, Ayush, which is I will talk about, and you give people Panchakarma regularly, you reduce CVD, cardiovascular diseases, by 93%. So when you go back to the UK and you inform whoever you work with in the government about the potential for complementary systems of medicine to reduce the burden on the NHS, which is absolutely terrible, and they say that the NHS accounts for 10% or more of the GDP, it's because, if I can tell your colleagues, I'm sorry to say this, it's the fault of modern medicine and its approaches to biology. So I'm actually engaged in integrating the science of the alternative, complementary, traditional systems of medicine with modern physical and physiological science. Because the Indian government is currently aiming to have a completely integrated system of medical education where every college at the bachelor's, master's level will offer not just the system for which it was founded, which could be homeopathy or could be Ayurveda or Siddha in Tamil Nadu, or it could be modern medicine, but they will all offer all 8 systems to a certain level at the undergraduate level, so everyone gains enough expertise so that they can then specialize. They could specialize in nephrology or neurology or other ologies from modern medicine, or they could specialize in one of the Ayush systems of medicine, Ayurveda, yoga, often known as yoga therapy when it applied to medicine, naturopathy, which uses no medicine and is remarkably effective. Unani, Siddha, and the Tibetan system Savarigpa, and homeopathy, which I mentioned before. Now, all these systems all promote this remarkable ability of the human body, which is to restore health given the chance. So they universally tell people, I'm not quite sure about homeopathy in this regard, but they tell people to stop doing things which will drive their immune system out of balance, which will drive their tridosha in Ayurveda and Siddha and Swarigpa, will drive them out of balance and so create the grounds for disease. So as far as healthcare systems, I put them in the following order. You have naturopathic medicine, just allow the system to get better completely naturally by giving it the deepest rest and not interfering with healing practices by letting people watch television till 11 o'clock at night. Okay, I'm nearly done. Yoga, which believes not just in the life force, but it calls the life breath prana, and it strengthens it through pranayama and Baba Ramdev's Kapalabhati, and that also impacts the main, what's it called? The, it's the lymph system, the main lymph node up the center of the body. And if you do the Kapalabhati, you will purify the lymph system and the interstitial fluids between the cells. So you hugely help the system. And then if you know how to restore the balance between doshas, you can further enhance the healing process. So I would like to offer one final thought to you all. If you want to enhance the strength of the immune system, I take Ayurveda Patanjali juices, what's it called? Amla, and another one of the famous herbs. I take them every morning, also with Chavanprash. Now, the Ministry for Ayush sent me a paper to referee, or they requested that I was referee on a particular submission. It showed that just taking Chavanprash morning and evening reduced the incidence of COVID. I don't think the trial was particularly well controlled, but it certainly justifies more trials looking at these complementary strategies, for which we undoubtedly need more evidence, and WHO has just held a wonderful conference reviewing the evidence for the complementary systems of medicine, because it turns out, to my astonishment, that Ghebreyesus, the chairman of WHO, really reveres complementary medicine from his upbringing in Ethiopia. So I have one more comment. When you get serious damage to collagen during a COVID infection, collagen damage can only be repaired with the help of vitamin C. But neither vitamin C nor vitamin D were talked about during the pandemic. And I do think that even Western methods, vitamins, minerals, and Eastern methods need to be more considered by your extremely exalted selves, for which many thanks for allowing me to talk.
Thank you for your talk, Alex. We appreciate that. Right, so I hope everyone had the questions ready. So I'm looking forward to some interesting conversation here. So, yes, the first hand goes up. Please give your name and the question. Okay, can I know with a show of hand how many of you have questions? 1, 2, 3, 4. Okay, so I will take 4 questions. I'll take 4 questions. And if your question remains unanswered, after the session breaks off, please get hold of the panelists over here, including me, okay, to ask your questions, okay? Because this session needs to end in the next 10 minutes. Yes, so let's have the first question. Can't hear you.
So, myself, Tun Patel. My question is, how much COVID-19 has changed the health system in Bharat, and do you believe that it has given permanent mark on our social economic development, and also the aftermath of COVID-19 on individual life and mental health?
You'll have to, okay, the first part of the question is,
how much COVID-19 has changed the health system in Bharat?
okay, and there was a follow-up.
And do you believe that it has given permanent mark on our socio-economic development?
So, directed to anyone specific on the panel, or can anyone answer?
Anyone can answer.
Anyone can answer. So kind of you. Yes. Yes, sir.
See, 2-3 things. As far as health infrastructure building up is concerned, when we are looking at Bharat as such, the country as a whole, we have learned a lot. We are trying to build up our infrastructure, but we are in the process of doing so. As was discussed at that point of time, we were falling short of intensive care units. The critical care we are talking of, both in terms of infrastructure and in both in terms of manpower, because we never had nurses which were trained to tackle or handle the critical care. So on these both front, Government of India is doing. Infrastructure built up is one situation or one case, and training or increasing the trained manpower is another issue. Both are being taken up by the National Health Mission, and they are taking it strategically. But as of now, we have not reached the stage where we should have or what we have targeted for. Second, your question was about economic impact. We all are quite aware about online meetings, online working. Everywhere it started, probably in government it was never heard of Zoom meetings and Google Meets and all those things. We actually had physical interaction or physical meetings. But it has now become a common thing. I was attending a meeting when I was coming here for the National Education Policy meeting. So online the meeting was going on when I was traveling here. So this has changed the way we are working. Even in IT sector, it has changed a lot, but because of probably moonlighting, they are thinking of switching over to the earlier system. So there could be, in a week, 2 or 3 days, physical attendance mandatory for the people working in IT sector. And that is, the people are themselves to be blamed because they started moonlighting in that area, working for some other companies other than who are paying them. So that's an area where, and the overall working system in the government and in all sectors has changed. Economy had one of the greatest impact, and probably another 2 years will take for world economy to come back to its original state. We have recovered fast, but that's not the case world over. Even US is likely to have and is going through, not exactly a process of recession, but they are not having the economic growth as was expected in pre-COVID times.
One area which has significantly improved in the country, and that's about the laboratory, diagnostic part. Yeah. So that is where you find in just 2 years, and the experts are here, virological investigations were restricted to only very few, including NIV, CMC Vellore, etc. Now throughout the country, COVID has really triggered. So on investigations or diagnostic part, we are doing a great job. However, the surveillance part, which is the core of the basics of the public health, still needs to be improved upon. So HR and then referral, surveillance. So all our broader perspectives are taken in mind, but it will take time. Things are moving in a right direction.
In a half minute, the just additional point, it is about the oxygen, because what has happened, this was never a problem in the system. So basically both storage system and the generation, we have improved a lot. The highest requirement of oxygen was 1700 metric ton in COVID, but when it came to the regular, it is just less than 1%. And therefore, on these both fronts also, the state and also at the national level, lot of improvement has been done in storage and generation of oxygen.
Thank you, ma'am. The next question, I think we'll be able to take just one more. On the right side, my right. Yes.
Good afternoon, sir. My name is Jyoti Rajprakash. I am from MIT WPU and I'm a second year MPH student. So since the theme of today is interfaith and public health as an initiative, so I would like to ask that you shed light upon how disaster preparedness can play a huge role when in terms of, when a health crisis emerges. So can you share a couple of thoughts on how public health professionals would be able to play a role in creating a global framework in managing disasters and managing healthcare preparedness before a pandemic or an epidemic sets on full fire? So yeah.
Public health? Anyone? Sure. Okay. A short answer.
Sure. Yeah. So when it comes to disaster preparedness, because as a mental health practitioner, I work in the areas of disasters and also with the refugees or victims of earthquake or floods. So the first thing that needs to be established as a first responder, you might be a journalist, a doctor, a psychologist, is that you establish safety, right? So we have a protocol that we call SPFA, psychological first aid. So that is one of the models that tells you what the priorities are. So for instance, if somebody has just lost their house in the earthquake and I'm telling them about therapy and mental health, they're not going to listen. We have to start from the basics. Does this person have a shelter? Does this person have food and water? And are they comfortable? And then comes the safety concern. Do they feel safe? Psychologically safe. For instance, in Turkey, there was the earthquake. The house is fine, people don't want to go in. What if there is an aftershock and the house falls? There were many buildings in which that happened. So there was a lot of fear. The houses are there and people are staying in the tents outside. So the first thing that you do as a first responder, not just as a therapist, which I am, you could be anybody who's interacting with the people who have undergone a disaster, is establish safety. So once the trust is built, then people are receptive to other things. So I think the first thing, of course, there are technicalities involved here as well, but I would say as human to human, people need safety. People need to feel that they can trust you as a stranger, and once that happens, then it's just an open game. Thank you. That would be a brief answer.
Thank you so much.
Okay, with that, I would need to end this session. I will just take 5 minutes to share my thoughts with you. When I started the session, I said it seemed as if the healthcare system had collapsed. Now, every organization has a certain number of people, which is the establishment. Every hospital would have an establishment cost. You have X, you cater for 100 people, you cater for the nurses, you cater for the doctors, you cater for the other administrative staff. And so that is the administrative structure that you put in place. Now imagine in this enclosure, the capacity of taking people is, let's say, 200. And if 2,000 or 20,000 people try and get into this enclosure, is that possible? Would you call that a failure of this establishment, or is that an extraordinary situation which needs to be set aside? My question is that. It is an extraordinary situation. You cannot have hospitals catering to 20,000 people. You can't have this room or a place to cater for 20,000 people because it's going to happen maybe once in a century. But what we do need to do is have a contingency plan that should a disaster of that magnitude happen, how are we going to deal with it? So I won't call it the failure of a healthcare system during the pandemic, but I will say that maybe we were not prepared with alternates. The country, our country, and the world over, everyone has learned. Now let me give you an example. Archana ma'am was speaking about oxygen. The country and the healthcare world and the industry learned that how to see, you have industrial oxygen which is at about 95% purity, but the oxygen required in a hospital is 99% pure. So the industry learned how to flip that production of 95% pure oxygen to 99% pure oxygen should the requirement arise. Okay? Now, these are kind of changes and innovations that have happened in the healthcare world, not only in India, the world over. So we are better prepared. And if something like this were to happen, the results would not be what we had witnessed. Dr. Prabhakar had spoken about communications and how the faith-based organizations, how the religious leaders, how our Panditjis and the Maulvis and the Granthijis in villages can help. When a crisis like this happens, what is the first thing that grips you? First thing is fear. You don't know what's happening. There is no information coming to you. And it's the fear of the unknown. That fear makes you do crazy things, okay? It leads you into desperation. Now, in that desperate act, a lot of things can go wrong. So that's where the faith-based organizations, your religious institutions, I come from Punjab, every village has at least 1 or 2 gurdwaras. Every place you have mandirs, masjids, churches, everywhere. And it is these religious leaders who can reach out to the community, calm them down, educate them, give them the right advice, and that in itself will help with a pandemic, with a situation where things seem to be going out of control, right? So faith-based organizations have a huge role to play in the healthcare system. Coming from a hospital, death is something which is really, really, it breaks a family. In our hospitals, in Punjab, we had a Granthiji, and the Granthiji's job was when somebody died and the family would be taken into a prayer room and the Granthiji would just speak to them, calm them down, and get them to accept what's happened. So faith has a great role to play in health, in mental health, okay? In spirituality. So the minimum level of care. The other point that came in was that, people who had money thought they could deal with COVID. Well, they were proven wrong. And so I come back to what happened in Mumbai. I saw a 1-hour video on how Mumbai tackled the second wave. The commissioner of the Bombay Municipal Corporation, Mr. Iqbal Singh Chahal, he just got things under control. No one could go to a hospital to say, I've got COVID, I need to be admitted. No. There was a system the war rooms, as Archana ma'am had said, there were war rooms. There were 69 dedicated COVID health centers that were set up across Mumbai. And your first point of contact had to be there. You had doctors over there manning that center 24/7. They were manning your oxygen levels. They were manning they were telling you how to deal with, what medicines to take. Only if somebody needed hospitalization, it was on the recommendation of that center that a person was sent to the hospital, right? So there was no panic because information was flowing. You had someone telling you that, look, you're not that unwell. Your oxygen levels are okay. This is the medicine you need to take. We are there to constantly monitor. So the confidence that a person got was tremendous. And with that information, with the confidence that I have a doctor at my beck and call, a person calms down and you start thinking rationally. So, I end this session thanking the panelists for their contribution and their thoughts.
Thank you, sir.
And I'm sure the students over here have really, really gained from the ongoings. And I saw a lot of hands coming up. Somebody wants to ask a question after the session. Like I said, please grab hold of any one of us and get your questions answered.
Thank you.
Thank you very much for this opportunity to speak to the students over here, ma'am.
Thank you, sir, for those words of wisdom from our moderator. A big round of applause to the moderator and all. As concluding part of this session, we express our grateful and heartfelt gratitude to our moderator, Colonel Harjit S. Bhagatji. And we also express our thanks to our esteemed, eminent, expert panelists whose presence, participation, passion, and patronage made this session enlightening and engaging. The panelists' commitment to the cause of healthcare, sustainable development, peace, and democracy are evident and are truly commendable. My sincere thanks to all the participants and students whose presence, participation, and deliberations made this session a successful one. I know that there are many students with lots of questions. We will be having an informal interaction with the panelists. Last but not the least, I also express my gratitude to all the supporting staff, technical team, videography and photography team, student volunteers, and organizing committee of G20 Interfaith Summit 2023 for providing all the required support to the session. Thank you all once again. Jai Hind, Jai Bharat. Now I request all the dignitaries here to join together for a group photograph. I request all the faculties to join for the group photograph as a memory to this session.